30, and as we know, during this time of year there may be house parties or other events. We want all of those limited to 30, and please make sure you have a list of everyone who attended or is attending your home. Secondly, all venues in those 4 local government areas will resort to the 4 square metre rule, and we ask for everybody to stay seated and not stand. Now, the positive news in all of this is we're not saying to businesses, shut your doors, quite the opposite. We're saying you can keep your doors open, but because of the risk that's there, we want you to be extra cautious. So until the end of Easter, you are able to keep your doors open, but make sure you revert to the 4 square metre rule, and make sure that all of your patrons are seated and not standing up and mingling. And I think given what's been identified since 8 o'clock last night, the community and our citizens would understand why we're taking these measures. We also ask for people in those 4 local government areas to wear masks, and we will be making this mandatory in retail, if you're going shopping, in hospitality venues if you're a worker, on public transport, although we know most people will be going around in driving, so that includes taxis and Ubers. Make sure you wear masks until at least the end of Easter as a precaution to make sure that if there is any community transmission we haven't got under control, that we maintain that. Now, that will be pretty much the extent of our restrictions for those 4 local government areas. But there is another important message I want please the community to follow, and that is it is our strong preference, it will not be mandatory, but it is our very strong preference that if you live in any of those 4 local government areas, that you don't travel outside those local government areas. We won't be policing that, but it's very strong advice, because we don't want, if there is community transmission, we don't want it seeded to other parts of New South Wales. So we're asking everybody, if you live in those 4 local government areas, feel free to travel within those 4 local government areas, but we would ask for you to reconsider your plans if you were planning to go to other parts of the state. And similarly, we're not going to tell people to stop going to those 4 regions over Easter, but given the new restriction about the 4 square metre rule, venues which previously could take more people may have to take less people. So we ask everybody who was attending those local government areas to reconsider their plans, although again, we're not saying it's compulsory not to go, but certainly we want everybody to be on high alert. So this is a situation in New South Wales. The reason why we're not going as far as the other states is because the systems that we have in place, we feel we can get on top of things as they are, but it is an evolving situation, and if the health advice changes, of course we will reconsider that. But at this stage, there is absolutely no cause for us to close borders. There is no cause for us to go beyond what we're advocating. But we do ask citizens, especially in those 4 local government areas, to be extra vigilant, to come forward for testing. And we do want to thank this particular person who was tested positive since last night, who has been outstanding in the way in which they checked in, they've cooperated on and supported New South Wales Health. And pleasingly, I was going to let Dr. Chance say this, but I might say this, that 3 other people who in his household have tested negative to this point, which is a positive outcome. But having said that, whenever there's a case of community transmission, we're always on high alert. We still don't know whether people may have brushed up against each other casually in an area outside of that local government area, those local government areas, but we know that those 4 local government areas have a lot of interaction, a lot of mixed functions, a lot of events, a lot of family. And so please accept the advice we're giving in the strongest possible way. And please know, though, that the restrictions we have put in place will be mandatory. So the mask wearing, the 4 square metre rule, the seated will all be in place. And I can confirm that Minister Hazzard has been in direct contact with the organisers of the Blues Jazz Festival in Byron to manage that, and we'll be making Health will be putting out a further statement about that later today. We are discussing, or the Minister is directly discussing with the organisers the options that are presented in a COVID-safe way, and Minister Hazzard will outline a bit more of that in his comments. Now, before I hand over to Dr. Chant to give us the medical aspects of what I've just described, I want to make this point. I was very concerned to read particular reports in the press today about the New South Wales government vaccine rollout. The facts that were presented are not true. And I say that as someone who works part of our great team in New South Wales day in and day out to make sure that we roll out the vaccine as quickly as possible in New South Wales. To put things into perspective, around 150,000 people in New South Wales have received the vaccine, either the first shot or the second shot or both. 100,000 of those were provided by the New South Wales government. 50,000 of those were provided by the Commonwealth, just to put things into perspective. And please note, as many of you here and at home would know, that for many weeks I've been saying to the Commonwealth, to the federal government, New South Wales is ready and willing to make sure that we support you in the vaccine rollout. So beyond what we've been asked to do, we've done around, Minister Hazzard will confirm these figures, we've done around 100,000 and we've only been asked to do 300,000 in total by the end of phase 1B. What we're saying to the Commonwealth is we will have at least 100 hubs across the state. Please allow us to work with you so that we have a chance of meeting the October deadline. So we have put this request in, and I'm going to write formally to the Prime Minister today, but I think all of you have heard me say, as Minister Hazzard has expressed to his colleagues, as I have expressed to my colleagues, the only way we'll have a chance of meeting those deadlines is if the Commonwealth and the state government work cooperatively. But what is also extremely unfair is that when we are given 24 or 48 hours notice about how many new doses we're getting, and as you can appreciate, disseminating that within 24 hours or 48 hours is a difficult task. And so I just want to put the facts on the table, because it's so important for us to not only vaccinate as many people as soon as possible, but also to make the vaccine available through multiple channels. And we want to work with the federal government to make that happen. But I will not have untrue statements made publicly about what is a complex system. And I want to take this opportunity. I cannot tell you how grateful I am to all the health workers who are involved in the vaccine program, but also the people who've received the vaccine. Our quarantine workers, our high-risk health workers have put themselves on the line every day for more than a year. And I don't know what that's like, unless you're in their shoes, fearing you're going to get the virus or give it to someone else. And I haven't heard of a single incident where people have resisted or not followed those health instructions. And I'm deeply grateful to everybody who's been in that situation. Please know that the New South Wales Government supports you. We're grateful for what you're doing, and we're really keen to work with the Commonwealth cooperatively to ensure the vaccine rollout as quickly as possible. Minister Hazzard will have more to say about this. It's fair to say that he and I both feel the same on this, and we intend to make sure our citizens not only maintain confidence in the rollout, but know that our government wants to speed things up. I'll now pass to Dr. Chat and then allow Minister Hazzard to say a few words. We'll probably have more than a few.
Thank you, Premier. So just to reiterate some of what the Premier has already indicated, we had one new locally acquired case of COVID in northern New South Wales. The case was a gentleman in his 20s who attended the Byron Beach Hotel with 3 other of his friends, and he sat in proximity to the travellers from Queensland who were infectious at the time. 3 of those friends have already been tested and were negative, and this gentleman promptly, on hearing about this issue, presented for testing, immediately did the right thing in terms of self-isolation. Now, because we go back in terms of infectious period, we have identified some venues that he went to, and just can I reiterate, he went there not knowing he'd ever been exposed to COVID. And so that is the Ballina, at Ballina, the Henry Rouse Tavern at 117 River Street on Sunday the 28th of March between 1:20 p.m. and 2:20 p.m. and the East Ballina at the Ballina Golf and Sports Club Pro Shop on Jamison Avenue on Sunday the 28th of March between 2:25 p.m. and 2:35 p.m. What we're asking people to do, if you attended those venues, please immediately self-isolate and get a test, and we will be advising you after we've done that formal risk assessment. People who had signed in to the Henry Rouse Tavern in the vicinity of this gentleman would have been texted last night at around 9 o'clock, and they would have been advised to take this action. But we are aware that sometimes people are not using the QR code. So if you know you've been there with a friend to any of these sites, please remind them and alert them to this public health advice. Also, this morning in the press release, I'd just like to draw your attention to the fact that we're adding additional casual venues. So when we're interviewing and re-interviewing cases, they obviously recall that they've been in different places, and hence the list of the Byron venues is growing. But also, the point I'm trying to make is please continue to go back to that website if you've been in Byron over that period, from that Friday till the Sunday, and keep checking the website. We're also asking, because they did actually wander around the shops in Byron, we're not absolutely going to be sure that we can identify accurately every shop that they've went into. So if you've been in that general vicinity over that 26th to 28th of March, please get a test. And if you've got, if that is negative, but even if it is negative and you have symptoms subsequently, please get a retest. Everyone at the Byron Beach Hotel will be asked to quarantine for the full 14 days and get a test at the beginning. And that test that people have gone, and I thank you for doing it so promptly, helps us really assess the risk of transmission in that venue. But you are required to stay in isolation for the full 14 days, and we'll also be advising you to get a test prior to exiting your isolation period. As the Premier's indicated, there's a range of restrictions that are being put in place, and the idea is that these remove some of the risk behaviours I've talked to you about. So we would be encouraging people in that Byron vicinity to reinforce their mask wearing, and we're doing that through a mandatory public health order. But the weather in that neck of the woods is quite delightful at this time of year, so we do encourage people in that vicinity to enjoy outdoor environments. They are much lower risk, and so if you are selecting to have friends over, please preference your outdoor verandas or outdoor settings, or go to the beach or enjoy the bushlands. Try and maintain those COVID-safe practices, and above all, check the QR codes. Could I also put in one other reminder, and that we are contact tracing. We do it through a variety of means. We both text you, but we also do call you. And there is the capacity, if people are having difficulty self-isolating or people are concerned to check in advice, please contact us and we can clarify that. But please answer your phones if you have a no caller ID just at this period of time. I know a lot of people won't generally pick up the phone, but if you've known you're at their beach hotel, you might have doing the right things and know what your plans are. But the fact that we've made contact with you means that we can inform you if the risk changes. It means that we can also facilitate testing if we have information that we want to convey with you about your higher risk status because of where you may have sat in proximity to the infectious people. So we just ask you to just pick up that phone call, and that helps us manage the many calls that our contact tracers are conducting at this point in time.
Thank you. But first of all, in regard to the unfolding issues on the North Coast, clearly, there are issues to be managed, and the public health officials, Dr. Chant and her team, are managing those as best as is possible. There is, however, one major festival that was to occur, is occurring at the present time, and that is the Blues Fest Jazz Festival, commencing tomorrow. I have been in discussions this morning with the organisers because there is a high level of concern from our public health officials that with these new cases that have come from Queensland, and then the newest case that we've heard about just overnight, that we all need to be on high alert. What I would say is that if it were absolutely safe, then we wouldn't be making this comment. But at this stage we do have concerns, the government has concerns, I have concerns as Health Minister, that having 6,500, 9,500 people up to about I think it's about 15,000 on any one day, could be a challenge if some of these people who may have got the virus from this infectious group that, as I said, came unfortunately from Queensland, could cause some concerns for us, particularly if there were further transmission of the virus. So those discussions this morning have been with the organisers. We've expressed our concerns and noted that we'll be working with our public health officials today and we've asked for some information from them, and they've been very, very obliging on that front. That is the organisers and the public health officials. It's difficult. It would have been better if the Blues Fest had been perhaps in another few months instead of right now, or it would have been better if we hadn't had a hens party in Byron Bay that appears to have now brought down our more secure North Coast area into now a highly suspect area. So at this point, all I can say to those people who might be intending to attend and to the organisers themselves, which I've expressed to them personally, but to those who might be intending to come, just be very alert to the messages that will come from the New South Wales Government in the next 12 to 24 hours as we look at the unfolding situation on the North Coast. It is important that, and complex, so complex, that we weigh up the competing interests of trying to let people do what we've always done in New South Wales, and that is have as much freedom as possible to enjoy what New South Wales has done so well, what has been referred to as gold standard approach to managing this virus, but also to make sure that we keep people safe. So it's not an easy one. Can I say on the other front, the Premier talked about, in terms of news reports today about the vaccine that appears to have emanated from the federal government, those news reports. Let's get this really, really clear. The New South Wales Government was asked to roll out 300,000 vaccinations to the groups in 1A and 1B. Of that, we've done 100,000. The federal government was asked and is responsible for 5.5 million people, and they've rolled out 50,000. I think the figures speak for themselves. Now, up until today, for 15 months, every government in the country, every state and territory government, has maintained a very collegiate approach because we want people to feel confident in a collective government decision, federal and state. But as Health Minister here in New South Wales, I'm extremely angry. And I know there are other health ministers in the country who share similar views, state and territory health ministers. It is not appropriate that we wake up and find figures put into the media that haven't been shared with any state or territory governments. It is not appropriate that those figures be put in a light that is quite misleading. I can assure the community that your state government here in New South Wales is doing everything possible to roll out the vaccines that we are given. As long as we get the plans going forward for the correct amounts of vaccine, we will roll it out as quickly as possible. I want to remind the community here in New South Wales, as the Premier just did to some extent, that the people who are doing the rollout are our frontline health staff, our publicly employed frontline health staff, and of course the federal government are relying on private companies and GPs. I think we've all heard some complaints in the media from GPs about that rollout, and we know that many aged care facilities that were expecting to see the vaccine haven't got it. I think that's understandable because it's been difficult for the federal government to know what amount of vaccine, particularly the AstraZeneca, would be available, having in mind the problems that were existing in Europe. And they've been reliant on the CSL rollout from Victoria. And we've been understanding of that. But to then go dumping figures into the media, which actually are quite misleading, is wholly inappropriate. Very, very disappointing, and I think is not really helpful in ensuring community confidence. So let me make it very clear. I'm as angry as I have ever been in this 15 months of war against this virus. All governments in Australia should be working together. Can I point out also that just in New South Wales alone last week, we're in week 6. We're in week 6. Last week was the 5th week. We were under the impression from the advice that we'd received from the federal government that we'd receive around about just over 13,000 vaccines. What they actually gave us with no forward announcement was 45,000. And now, less than a few days later, there's a press report saying we haven't distributed them all. Well, you get 45,000 items dumped on your front door at night and told, well, now you should have it out by the next morning. No one would be able to do that. And I've got to say that I know that our frontline health staff, our public health staff, have been working into the wee small hours, night after night, to do what they've done in the last 15 months. One day we're the gold standard, the next day we're being told we're not. Well, we are still the gold standard because we have amazing frontline health staff. And if we're given the clear evidence and indications of what we're going to get, we'll work to that. But as I said, not happy at all today, and I think that the federal government should be proffering some apologies to not only our government but other governments around the country, because you need to know, if you're going to win a war, you can't have the tanks and the artillery all dropped at the airport and told about it and then go public about it a few days later. You've got to know what your supply lines are, and you've got to be able to work to those. And we are at the front line of a war, New South Wales and the other public health teams, and we have been doing a very good job with our public health officials, working hard. I really find this very offensive.
Premier, you've received 190,610 doses. You haven't disputed that figure, so I'm going to assume that's correct from the federal government. We've only done, your words, 100,000 jabs from that 190,600 that we've received. Where is the rest of the 90,000 going to go, and how quickly will they get into people's arms?
Well, firstly, I can't confirm the figures you've given me because they're not the figures, the most recent figures I had. In fact, I had a meeting this morning with Minister Hazzard and the health officials. This is the point. It's unfair to go out publicly and comment on the rollout when you literally only let the state know in the last 24 to 48 hours or delivered what those new doses are. What the people of New South Wales, I hope, know is that we are working night and day to get all the doses out as quickly as possible. I don't know any other state that has 100 hubs either up and running or in the process of. And I also say this, 100,000 doses that we've issued in 5 weeks, and it's slightly over, I'm being conservative. It's actually 156,000 doses that have been given out in New South Wales, is a mighty effort. We had floods and we kept vaccinating people. We've had all these other challenges and we haven't let ourselves be distracted. But what I find disappointing is not so much the he said, she said, and I'm normally a team player and don't engage in that. However, where public interest is concerned, where getting our residents as safe as possible, as quickly as possible is concerned, I'll stick up for my state and I'll stick up for my workers. And can I also make this point, that we have offered on a number of occasions that we are happy, more than happy to do far in excess of the 300,000 we've been allocated. We support the GP network. Our GPs are as frustrated as we are. We support them, we support the pharmacies, but all of us should be working together. I think I've said on many occasions, we need all hands on deck if we are even going to get to the October deadline of having everybody vaccinated. I'm keen to do that, because it's in our state's interest, it's in our nation's interest to do that. But I do agree, and Minister Hazzard, I know, has been working behind the scenes, and we need to have one rollout plan which involves the states and the Commonwealth together, rather than the he said, she said. That has to stop.
You've got 90,000 jabs on the shelf.
Well, that's on your figures, and with all due respect, James, I'm sorry, with all due respect, there's no point in delivering something to us a day ago or 2 days ago and saying you haven't rolled them out.
But when are they going to get into people's arms is the question.
Well, as quickly as possible. And I say this, look at what we've done. We've done at least 100,000. The figure goes up substantially every day. We've done at least 100,000 out of the 150,000 in New South Wales. The New South Wales government has done 2/3, even though the Commonwealth is in large part responsible for the vaccine rollout. But I can't, you are all witnesses to how many times I've said publicly, let's work together. Let us keep standing up our hubs beyond the phase we've been allocated, beyond the 300,000, because we have capacity to do tens of thousands of extra vaccines every single week. And we want to do that. But we need.
They're happy for you to do that though, so when's that going to start?
Well, as soon as we know what supply we're getting. We need to know what the supply is. We often find out 2 days before we get it or the day before we get it. We need to know, and we appreciate the difficulties. We have been cooperating with the federal government in relation to their argument that supply is lumpy because until we get the manufacturing up and running, and we completely accept that. And that's why we've been patient and we've been quietly getting about our business. But to wake up to those reports is contrary to what we've been working towards, because we appreciate that they can't tell us all the time what we're getting because of the issues that are before them. They therefore need to offer us the same opportunity to respond to untrue statements about New South Wales lagging in relation to this. 100% of our quarantine.
How much warning do you need? You said you got 48 hours notice ahead of those 48,000 doses. Do you need a week? Do you need 2 weeks?
Well, ideally as much time as possible, and however, that's not even the issue. The issue is the need for us to work together, to accept the challenges and constraints that exist, and they do exist.
Premier, just to clarify, I know that these were dumped on you at the last minute within 24 to 48 hours, but the facts in the report are correct, right? There are only 50%.
I'm not willing to accept that at all, because
If you come to a press conference about figures and you haven't got the figures,
no. What the figures I know is how many jabs have gone into arms, right?
no,
And the figures.
Press conference about how much has been
Right,
delivered
I'll ask
to
Minister Hazzard to outline on that, but I will say this, that we have distributed in fact, when we had enough notice, our dosage rates per week were up to 90% of getting the doses out, right? So when we get enough notice, we're able to get out 90% of what we have or more within a week. But I'm just being absolutely honest with the public in what the situation is, because I don't want there to be a perception that there's all these doses sitting there and the state's not rolling them out. That is the wrong perception and it's the wrong fact.
There are doses on the shelf.
I'll just ask Minister Hazzard to update that.
Can you pull that one up? Can I just say this, that the logistics of getting out the vaccine is entirely the state government. We've actually put together 42 areas, venues where the vaccine can be given out. Every dose of the Pfizer vaccine, of course, that was the first one that came out, has been used. The AstraZeneca suppliers have been erratic, to say the least. And if we're told that we are getting 13,000, I think it was 13,700 to be precise, doses last week, that's only a few days ago, and then get dropped 45,000, that's entirely fine, provided we are then given the opportunity to roll it out and to make sure it's logistically sent out, and we can organise all of the staff and all the appointments with people, as you would be familiar. Some of you have been at the hubs. They have to be booked in. People have to be booked in. They have to be actually given the appropriate time to sit in the space. There's got to be the capacity to do it in the venues, and we don't have a problem with that. We're quite happy to do that. What is infuriating is the then dumping on the state government by saying that that hasn't gone out already, less than a few days later. It's just, it's an announcement designed to undermine rather than to support the government's rollout. And that is not good when you're dealing with a war against a virus.
So why do you think
Hang on, sorry. You've got to understand that when each of these new doses arrive, if it's not what we've planned for, we have to bring in additional staff, we have to get it transferred, we've got to be able to make appointments with people to come in. It's not overnight. And no problem with them giving us extra vaccine, as long as they then don't go publicly saying that we haven't put them out, because that just shows an ignorance about frontline delivery of services. And I think perhaps that's because the federal government doesn't deliver frontline services. Sorry, you hang on. Ladies first. Ashley first.
So why do you think then, in your words, the federal government is trying to undermine your state's rollout of the vaccine?
All I'll say is that I've let Greg Hunt know my anger and agitation, and he's provided a justification which I don't accept. It had little to do with us, actually. It had to do with another area of the country. But whatever it is, to give out those figures, I mean, just imagine, as governments are trying to work together, and if there are figures on any aspect, whether it's the vaccine or something else in terms of the supply issues, that should be shared with us privately. It shouldn't be dumped into a particular media outlet and no opportunity for any responses. And I know that no minister in the country knew that was coming this morning, no health minister. So the media outlet that was given it also apparently contacted nobody in relation to it. But that's another issue. They were obviously given that as an exclusive. Well, the exclusive is our government is doing everything we can to make sure that every citizen in New South Wales gets the vaccine in their arm if they want it. And so far we have been doing, our frontline staff have done an extraordinary job to do that. But just dumping statistics into the public arena is not helpful. Sorry.
Are you saying?
Oh, sorry. I better go. Yeah, sorry.
Well, just to confirm, the figures you've got, they're accurate? You're saying that it is 50% for New South Wales or not? What would you say?
50%?
The vaccine's been delivered?
Oh, well, I know, because I've just come out of a meeting with the most senior health officials. I mean, Dr. Chant deals with the viral epidemiological issues, but there are separate people who deal with the logistics of rollout. And what they're telling me is, of the 300,000 that were supposed to be done in 1A, 1B by the New South Wales government, we have done 100,000.
I don't think
Sorry?
that's a question, Minister.
Oh, sorry, I'm not talking to you for a minute, James. I'm answering that question.
So
And
you said 300,000
that were 1A, 1B, we have done 100,000. Of the 5.5 million that are the federal government's responsibility, they've done 50,000. So, or in another way, of the 150,000 have been done in New South Wales, at the present time, the New South Wales government has done 2/3 of it. So it's basically a breach of faith. That's what it is, to actually go with that.
Doses are actually sitting on the shelves or in the fridges in New South Wales?
Well, we got 45,000 last week, I know that, and we were expecting 13,000. So there's some figure, obviously, that differential there.
Are you
So how
saving
many-
the vaccine for second
You next,
doses?
not you, James. I admire your enthusiasm to advocate for a particular news outlet, but I'm actually going to be giving this with everybody. Yes, go on.
Are you saving any of the vaccines to give out second doses?
No, I saw that. We aren't doing that because the federal government have given us the assurance that that they will provide those second doses if we need it.
And are you confident that they'll be able to do that?
I'm confident that the federal government are doing their best, and they have always been doing their best, to get the vaccines to us. The only disputation here is the fact that they are implying by what they have released today that we are not doing our best. We have done extremely well. And I find it, as the Minister responsible for all of those frontline health staff who are doing the work, absolutely offensive that that would be dropped into the public arena like that. Now, frontline, sorry Ashley, frontline doctors, frontline nurses working extraordinary hours, making the appointments with people to come in, making sure they get the vaccine, making sure that if they're immunocompromised, they have a doctor there to see them. They then go off and sit for 15 minutes to half an hour, and in some cases longer. It's a big logistic job. And to just do what's happened is, I mean, this is the first time you'll find that I've said anything negative publicly in 15 months, but I'm angry. Yes, James. Oh, sorry, Ashley.
Last question, please.
So just given what's happened with healthcare workers, where are we up to in the rollout in terms of healthcare workers? How many have been vaccinated?
All the frontline quarantine staff have been vaccinated, as we announced. We're now, and majority of frontline ICU, ED staff, but there are still some that need to be worked on. And then, of course, we have about 140,000 health staff. We have others, cleaners and so on. So we're working our way through that.
Can I ask about restrictions, Premier? Yeah, so
Sorry.
in relation to the restrictions, restrictions from one case of community transmission who would have been already in isolation as a close contact with a confirmed case. That seems to be a bit of a different message to the one that you've been recently sending, which is that we'll soon get to a point where we're not announcing every single new case.
No, the issue is because we want to make sure that given it's the Easter weekend, there's a lot of movement. We don't want a super spreading event like the Northern Beaches, which then resulted in us having to go further. So at this stage, our restrictions give confidence to business that even in those areas where there has been that heads party and the additional case that we've just had overnight, that businesses will remain open for Easter, and that is a very strong positive message. All we're doing is going a step or two back to what New South Wales had not too long ago when we had the 4 square metre. It wasn't too long ago when all of the state was subject to that restriction anyway. So this is to ensure that we keep the state open, that people move freely. However, in those 4 local government areas where we know the risk is much higher than other parts of the state, we're asking people to take those extra precautions, and I think people understand that. This means that businesses can stay open, people can still move around, but we just ask everybody to be on high alert. We ask everybody to get tested if they have the mildest of symptoms or if they've been to any of the venues that have been compromised. So we think this is very much a proportionate response. If you look at our response compared to other state governments, ours is extremely proportionate, and it's because we have, I believe, an outstanding health team, but also an outstanding team in Service New South Wales that are working with health to make sure that the systems in place get information to the public as soon as possible.
Byron's hugely popular for holidays. Are you saying don't go?
No, we're saying just know that if you do choose to go, that you will be be subject to these extra restrictions when you're there. So in an outdoor setting, as Dr. Chant said, you can still do those outdoor recreational activities without a mask and in the free way in which you can. However, in indoor settings where the risk is higher, what the intention is of these restrictions is to avoid a super spreading event, to avoid an event where someone may not know they have the virus and suddenly they give it to a lot of people. That's what we're trying to avoid. And so it's not that you can't go there, just be careful, make sure you're extra cautious. Please know that if you do go into a hospitality venue, you'll be subject to the 4 square metre rule. You can't stand up and mingle. If you want to sit down and have a nice lunch or a dinner, that's okay, but you've just got to be COVID safe. You've got to make sure you check in. If you're a hospitality worker in those areas, of course you have to wear a mask. If you're attending a place of worship in those areas during Easter, you'll have to wear a mask. So all we're doing is taking an extra precautionary step to prevent what we call a superseding event. And because people are moving around a lot, we don't want, if there is an unknown case we haven't picked up, we don't want that case spreading to Sydney or Newcastle or Wollongong or a larger town where that will complicate the issue. So this is just a very proportionate response to a case that's emerged overnight. We're pretty confident that, that because we've got more than 17,000 people tested, that we're on top of it. However, as you know, you might test negative on day 2 if you're in isolation, but then test positive on day 10 or 11. And that's what we have to be mindful of. And we have to assume that there could be more cases we haven't yet picked up on. That's why we're taking a proportionate response. We're still saying you can intend to do what you want to do, but make sure you stick to the restrictions if you are in those 4 local government areas. But we are saying to people who live in those 4 local government areas, feel free to move around freely and obviously make sure you maintain the COVID safe restrictions we've put in place. But we would prefer that until the end of Easter, those people living in those 4 local government areas didn't move outside those 4 local government areas. And that's not a mandatory request, it's just a common sense approach, so that if somebody living in those communities unintentionally has the virus unintentionally, we don't want them passing that on to other people.
Premier Michael Johnson has resigned, according to a statement from John Barilaro. Surely you would welcome that resignation, given your comments yesterday, and welcome the upcoming by-election in the Upper Hunter? Look,
I haven't seen that statement, but I'm very relieved. That is a good outcome, and of course we look forward to moving forward. Thank you, everybody.
Thank you.